Zoezi lingine ndio hilo naelekea upande wa jiji la Naivasha.
Government of Nakuru and the Department of Health, I welcome you here. This is one of the most critical activities that we do as a county government of Nakuru to portray or to display the commitment of Her Excellency the Governor to service delivery. We joined here today at the flag off of the medicine to level 2, 3, and 4 facilities by a team from the Department of Health, our two chief officers, Dr. Morema and Joyce Ncheche, our county secretary, our chief officer for resource mobilization, and then, our chief officer for sports and youth, Pastor Alex, members of the technical office in the Department of Health, our senior pharmacists, Dr. Wera and Dr. Alice. I think that's it. So I'm going to ask a representative from KEMSA to say something before His Excellency the
members of the CHMT, all protocols observed, members of the public, good afternoon. We, as KEMSA, we are so grateful to have been supporting Nakuru County and them supporting us in the last mile distribution of health product and technologies, going to all the facilities in the county, as has been mentioned by Waziri. And we also grateful that the county also believes in our quality, the quality of our medicines and affordability. And we want to appreciate that the county always calls on us in matters supply of the HPTs. I also want to mention that all these have been achieved by the great and good relationship that we've had with Nakuru County, because they always ask for the commodities and they're able to pay in time. And that's something that we really appreciate as KEMSA, because it helps us to restock and stock the items that have been supplied. So we appreciate you, and we appreciate Her Excellency the Governor for also ensuring that he's equipping the team in order to support the citizens in matters health and especially medical drugs as concerned. Thank you very much. I appreciate it.
For the state, the community, good afternoon. My name is Samuel Maura, the County Secretary. Mine is to thank, first of all, the Department of Health, because for us to get here, a lot of work has been done to get these orders from the health facilities, confirm what is available, what is not available, confirm the consumption levels, the consumption trends. So I want to thank the Department of Health Services for that good job they have done. Also, Your Excellency, I want to thank KEMSA, because in the delivery of these health products and technology, KEMSA guarantees us many things. One of it is quality. So whenever we have products from KEMSA, we don't worry so much about quality because they have the ability as the national authority in this to guarantee quality during procurement and distribution. We also want to thank them for the last mile delivery to our health facilities.
Waziri, CEOs present, representative of KEMSA, all the people present with us today, members of the 4th Estate, good afternoon. Good afternoon once more. Now this is a great day, and especially for us in Nakuru County, when we are going to flag off the drugs to our hospitals. I know this is the main agenda of Her Excellency Governor Wetu, because she's more particular about the health of our people of Nakuru County. I want to applaud her because she really keeps her promise. Whatever she says, she makes sure that she delivers according to the agenda or the promises he made to the people of Nakuru County. And again, I want to thank the KEMSA people for supporting us always whenever we call for them for any assistance. And again, I want to applaud the Department of Health for the work, the great work they are doing in our county. Thank you very much, because the way you monitor, the way you make sure that the drugs reach the destination, the correct destination, and whatever precautionary measures you are putting in from the dispatch up to the destination, I want to thank you so much. Continue doing that. What I can only request you is let us also try to educate the public, because some of the people do not know when they go to level 2 or level 3 hospitals, they don't know why they cannot get the drugs in those particular levels of the hospitals. Maybe I can request those people who are responsible in level 2, level 3, so that they can be telling the people why they cannot be treated in level 2 or level 3 hospital, where they are supposed to be treated in level 4 or level 5 hospitals. Because in most cases, some of the people complain that we didn't get the drugs, but it is because they cannot be given out or in level 2 or level 3. Otherwise, I want to thank Her Excellency for the good work she's doing for the people of Nakuru County. So on her behalf, I want to read her speech, because she was supposed to be here with us, but because of other commitment elsewhere, she asked me to come here so that I can be able to flag up the drugs for today. So I want to read her speech from Her Excellency. Good afternoon, ladies and gentlemen. We congregate here this afternoon driven by our unwavering undertaking to ensure the availability of health products to the people of Nakuru, which is an indispensable component of service delivery. We are therefore today flagging off medicines to our public hospitals in line with our pledge of delivering quality, affordable, and timely health care. Through the Department of Health Services, the county government of Nakuru, through the Department of Health Services, has purchased drugs amounting to 21,266,982 Kenya shillings from the Kenya Medical Supplies Agency, which will be delivered at the doorstep of a total of 216 public health facilities. Low volume level 4 hospitals, level 3, level 2, and across the county, all the levels across the county. The consignment being flagged off today is the result of an order placed with KEMSA for Q1 of this financial year 2024-2025, which amounts to a total of value of 23,241,312 Kenya shillings. To ensure continuous supply of medicines, we are expecting another consignment of drugs from the Mission for Essential Drugs and Supplies worth 22,082,528 Kenya shillings to be delivered within 2 to 3 weeks. These drugs are meant for the period October-December 2024. To ensure that high levels of accountability are maintained throughout the delivery process, consignments have been clearly labeled with the names of the respective health facilities they are intended for. Moreover, each facility will be presented with a delivery note at the time of delivery, which they are required to sign a bond confirmation that all the drugs listed have been delivered. As is the norm, 75% of the drugs will be delivered at the doorstep. Each hospital, while the remaining 25% will constitute the county buffer stock, whose role is to caution the health facilities from any supply chain shocks that may arise before the next order is processed and delivered. Due to delays in the NHIF and Linda Mama reimbursement to our health facilities, the revenue flow of most of them has been greatly affected. This means that the buffer stock now supports over even our level 5 hospitals, which has experienced the greatest negative effect of the delays. To further ensure that these drugs remain and are dispensed to patients visiting the facility, our members of staff are required to document all the quantities received in stock control cards. The stock control cards contain records of movement of drugs from the time of entry up to the point at which they are withdrawn from the drug store to the dispensing areas. In order to promote the rational use of medicines, I take this opportunity to remind the great people of Nakuru County that some essential medicines are primarily available at level 4 hospitals as guided by the government policy contained in the Kenya Essential Medicines list. This is because these facilities are equipped to provide a wider range of diagnostic services that aid the healthcare providers make correct decisions on the management of complex conditions. The essential medicine list outlines the medications deemed necessary for basic healthcare services, ensuring that patients receive the treatments they require without unnecessary delays or complications. Everyone must be aware of this system so that they can access the appropriate level of care when seeking medical assistance. I am further pleased to report that in addition to the consignment being flagged up here, non-pharmaceuticals worth 30,670,558 meant for Q1 have already been delivered and are awaiting distribution to health facilities across the county. Cumulatively, these supplies are meant to last us until December. This therefore means that the facilities will be adequately prepared to handle as such in incidences such as road traffic accidents normally experienced during the festive season. Lastly, I wish to also inform members of the public that the Department of Health is in the process of procuring various vaccines and antidotes valued at 2,449,972 Kenya shillings that are meant to bolster our preventive health efforts. These include, among others, the yellow fever vaccine that will be used at our vaccination center to inoculate international travelers as a prerequisite to international travel, and the snake antivenom to be used in the management of snake bites. I now flag off the trucks to hospitals. Thank you, Her Excellency Susan Kihiga, EGH Governor, Nakuru County. Asanteni sana.
Anzisha ni Nakuru Town West Sub-County. Makofi jamani, kwa kwanza kushukuru.